excuse me, my cough actually is going to come up as part of the story later, I think,
Yep.
but another story. So I've been shaking this sinus infection for quite a while, so I apologize if I'm unable to mute myself or something before I make a loud noise. But thank you all for attending. My name is Patrick O'Halloran. I am with WhereScape. We're sponsoring this webinar with Dr. Hightower and with my friend Mike Migalski from InfoVia. We're going to be talking about leveraging AI within healthcare, specifically how can AI help give information to doctors. Doctors are still the decision makers. Doctors are still the font of knowledge and training and experience. The idea of AI is just it can help present them with more applicable, faster information. But AI is definitely not taking over healthcare. Let me give you just a quick introduction on WhereScape, who we are, what we do. WhereScape is a software company. We've been around about 25 years. We started building data warehouses, large information systems, and started building tools for automating that. Those tools became very powerful. People started asking if they could buy them. And WhereScape stopped being a consulting company and began as a software company. So if you're building a data warehouse, a data mart, a data lakehouse, a data vault, data fabric, data mesh, data whatever, any kind of large data foundation, we've got the tools that will help you design, build, and operate that much, much, much faster. As I said, I'm here with Mike Migalski from InfoVia and Dr. Lawrence. Mike, do you want to go ahead and introduce yourself?
Yeah, well, I'm going to start with Dr. Hightower. David's a friend of mine and has helped our family significantly. Practices here in Boise for 31 years, and now he teaches at the ICOM medical school here. And I just appreciate him coming on. He's doing this at no cost. At least that's what we agreed to. I hope I don't get a bill in 2 weeks. But that's just a doctor jab. No, in all reality, what I've found to be true about Dr. Hightower is he's passionate about helping people. He is in this for the health of his patients. And so I'm honored to have him with us today. And we're gonna have a conversation about how data can help with the healthcare dilemma that we have. And so we're going to talk about some challenges and then some solutions, and we're going to talk a little about WhereScape, as Patrick introduced us. I am founder of InfoVia, and we build data platforms using WhereScape as a tool because it helps us move faster and provide insights to our clients in a more secure, more integrated way so that they're more usable. And we've been doing this for 7 years as InfoVia, and before that I was a WhereScape customer and have been using it since about 2015, so about 10 years in the business. And before that we were trying to manage data with other tools, and when I found the WhereScape and now what we call the InfoVia way, which is a better way of managing data to provide insights, we have helped many dozen organizations since then, some in the health industry, and we're going to talk about that more here in a moment. So moving to the next slide. Dr. Hightower, myself, and Patrick are going to have this discussion about healthcare challenges. Without automation, there's many challenges in the healthcare industry. Not only are there large volumes of data, but there's increased pressure and a high learning curve as tech infiltrates the industry. Dr. Hightower, can you talk a little bit about the quality of care and some of the challenges, either in your practice as in the ER or urgent care or wound care, and how some of those challenges have come to the forefront there, where maybe technology could help?
I think that for those physicians in general, what we're after is quality of care, and it's giving you the best care possible. And one of the things that's frustrating is that you're particularly in emergency medicine, there's a time issue. There are some things that you need to make decisions, right away, and you may have a limited amount of information available at the time. If the patient's fortunate enough to be in your healthcare system, then you can pull up that data. It's fairly available. If it's someone who basically is traveling from a different state, or their data is in a different healthcare system, or then it's like a deep hole in trying to access that. And then if the patient can't talk to you or something because of the severity of their presentation, it just adds one more layer. And we're also getting more data because I think that it's just expanding as far as how much data that is put into the records. And so all those things, it takes a toll on the patient, because you may not have all the information available to make the best decision. It takes a toll on the doc, because if it's a system that's not easily accessible, or if it's not easy to find the information in it, it just adds another issue to your stress and workload, because you don't want to miss something and you want to be thorough. And so anything that could be helpful to decrease that stress and provide and give you the information so you can make the best decision possible, I think is helpful. And that's partly why I felt like investing the time with you all, because if it can change how could change and improve the care that I can offer a patient, that's what I'm after, for giving them the best care possible, care that I'd want for my family. So.
Are you finding that electronic health records, health data exchanges, and the systems you use within the hospital, those technologies, are you finding that they are enhancing the availability of a patient's data? Are you finding that it's easy to put your hands on that record first? We'll talk about processing the record later, but just putting your hands on a complete patient record, is that getting better?
Well, it's I'd say yes and no. I think it's gotten better in some ways, and it's been gotten more difficult in others. Partly sadly, but decision making, just as far as if I want to, I get job offers all the time. But I wouldn't even consider it if it was in some of the healthcare systems that have some of the electronic medical records that I consider difficult to navigate. And so that's one of the factors that you factor in on where you're practicing. So I'd say yes, but I'd say there's also there is, however, difficulties in that access and bringing if it's in other systems, such as eClinical is one of that's one. And does it bring information? Can you get information when you're working under the Epic system to bring the records in from eClinical? That can be a challenge. If a person's in a different state, can be a challenge. If a person a different health system, those things can be a challenge. They do have some databases that try to pull those things in, but then you've got to be able to have the time to be able to do it. And so anything that could make it more efficient to give you I'd say the things that you think is relevant and important at that time, at that moment, I'd say that's still lacking. You have some access, but to a point where I would like it, it just adds an extra, I'd say some access, but it's not ideal. It's not where I would like it to be. And that can be specialty specific too. There's things that I think are more relevant when you come and see me in the emergency department that, another doc in a different specialty, really doesn't think it's really not necessary. And so, or vice versa. So
you'd kind of like to be presented with a menu, and where the options are at your fingertips. And what I'm hearing is the IT systems in the health systems that you've been a part of, and you've used probably all the large ones. We won't name all the names, but they fall short because of either their access to their data or their ability to provide it to you in the way that you need in order to make your decisions. Would you say that's true?
I would say that's true. Or decisions quickly can be a challenge. Yeah.
Yep.
So yes, I would agree with that.
So, Dr. Hightower, I
Well,
assume one of the problems is not having enough information. I assume having too much information is also a problem. If you're presented with a 40-page
Mhm.
case history and you've got someone in front of you grabbing their chest and can't breathe, you've got to make quick decisions. So I assume
Correct.
pulling data from multiple systems and having case histories going, every single case history going back 10 years is just as much of a problem.
I agreed. In fact, we joke about it to patients. And at times, I'll walk in, and if it's not a life-threatening case, well, I just got done reading your novel, and because the huge medical record, especially those individuals that have chronic medical problems that require that had multiple admissions, et cetera. It can, and then you have multiple specialists that see these individuals usually, and so you're looking at reviewing 4 or 5 different, could be for myself, review the last time they saw their cardiologist, their nephrologist for kidney issues. That just adds up, and all those things take time. But you're right, you have too much data also, and then you're just inundated. You don't have the data that you really need that's important to you at that time, at that moment.
but yet you're still accountable for that.
Oh, absolutely.
Legally, ethically, and you feel the pressure. So it has to be immense stress on a practitioner like you.
Yeah, it does. And I think it's also, most of us are in the field because we want to help people and we want to give them the best care possible and provide the care that we'd want for our family. And so that adds to it, because then you look at it as that you're not being able to provide the care that you really want to. And where most of us are perfectionists at heart too. And so and we take things very personally if we miss something. But yes.
I remember a call that you made to me a few years ago on a personal basis, and you were distraught about something that had happened in the ER, and it really opened my eyes. On my worst day in the data industry, people don't die, but on your average day they do. And so that stress, I think, if we with technology can bring you better insights so that you can make a better informed professional decision, then we're doing our job and we're partnering with you in the right way.
Oh yeah,
Yet
that would be
the medical record doesn't have everything you need all the time. You
no.
need population health. I talked to a health. I'll let you comment and then I'll go on.
No, you're exactly right. I mean, that adds just one area of stress, because you want to be the very best for your patient, and when things get in the way, such as an unorganized medical record, or the information's there, it's there, but you can't find it, or then you find it later, and then you're frustrated because well, why didn't I know this prior? And so you're exactly correct. It adds an extra layer of stress to what you enjoy doing, which is providing good care to the patient.
Right.
So
And something I've learned from you.
Go ahead.
No, please finish.
I'd contend that it's one of those things that's adding to the burnout and pushing docs out, because of just those challenges that we're talking about.
Sure. Yeah, probably our most needed resource in the world, and many of them are retiring early because of the stress and or risk involved. You've shared some examples of that with me. We work with some health systems, and you would think, well, the EMR just needs to just get better. Health data exchanges are starting to build a mesh where my data is available to anyone who has the business of seeing it, rightfully so. But it isn't just about my record, it's also about the population's record. Can you talk a little about integrating my record with population health or other diagnoses or treatments that presents an opportunity?
Well, I think that it does present some opportunity on the population health side, because of, if you could take a population, and we know that there's certain individuals that have a number of chronic medical problems, that those individuals, they do better if they are referred to particular specialists, such as palliative care, where they it's a team approach on approaching the person's multiple medical problems. That increases the quality of care they get, from a standpoint of the patient's more satisfied, because they're addressing the things that's really important to the patient. But it also can save in the long run, it's been shown, as far as healthcare costs, et cetera. And so from a population standpoint, population health standpoint, that could be valuable to a healthcare provider, because you're providing overall, there's a win-win. It's the patient's more satisfied and their family, because they're getting the exact thing that they value, as far as not what the doctor values. They're getting a team approach, and then from the system standpoint, it's been found that there's overall less costs, because their problems are being able to be managed more as a outpatient than within, sending it to the ED, et cetera, multiple times a year. That can decrease those costs overall. And so from a population health standpoint, that's one of the things that could, if you had something that basically evaluate the population, you could then take those groups of people and at least prompt the doc on, hey, this may be something that this patient would benefit from. And if that, sometimes that little prompting is all it would take for at least me as a doc who's, swamped with things, to think of, that's a good idea, and I agree with it, and then make the referrals. So, and it still gives me the option to bring in other things, from the standpoint of, well, maybe that's not the best idea, but it can be as subtle as, if you had to analyze it, it's what's called, as far as analyze the charts, if the patient was at a higher risk, the likelihood that he's not going to be able to fill the script, I'd like to know that, because it doesn't do any good for me to write the script if he can't fill it. If he has no transportation to go see the follow-up doc, that's, again, if if it would prompt me for something like that, that would be helpful, because there's no reason for, how can I refer someone if I don't take care of the transportation? And so those things can could also make a huge difference on providing the best care for that patient, to ultimately, so he doesn't, that he gets the care he needs, doesn't end up in the hospital.
So I know I'm oversimplifying this, but you just mentioned the health record, and then you mentioned the social determinants and the population health. And those are just 3 data sets, and they're both gigantic and complex. But I talked to a health system the other day that had over 1,000 source systems for their data warehouse. So we've just talked about, essentially 3 types of those, but the veracity and volume of that data is overwhelming. And that's kind of what we try to help solve, because that tech learning curve is real, and we can't expect doctors to be technologists. So we need to make that easy. Access to multiple data sets where they're integrated together with easy access for the professional when they need it, and literally life and death is on the line. Have you seen some technologies that you really, thought were moving in that right direction?
I'm starting to see more and more technologies move in that location, that setting. My hope and hope, and partly why I do this and volunteer the time is hopefully it can be presented in such a way that doctors will buy in, so that they can use and apply it, and also so that we don't lose sight of the patient, because that's the other challenge is what's best for my patient, and what things and that it will enhance the experience that I have with my patient, not take away from that experience from them. One of my parents have mentioned just recently that one of their frustrations is that the doc never did take his eye off the screen and look at them. And so it's going to be enhancing that experience, and I'm all in. And I'm my concern is if docs don't give their input, we're not thoughtful about this process and what we're, that it's just going to further alienate that patient-physician relationship. And then it's moving in these directions. So hopefully it can be, directed so that, it's going to enhance that experience. So that's my hope.
Yeah, I know they're moving in that direction. My wife works in mental health, and she complains that she has a hard time maintaining eye contact and having a conversation with her patient, while at the same time taking notes sufficient to be able to recount the results. And then she's got somebody else following up right on the tail of that person. And by the time the end of the day comes, she can't possibly remember every conversation she had with enough detail. So health providers are humans too. You need help with that. And I know there's audio recordings that can be done now, even within the realm of HIPAA and protecting the data. You can take audio recordings of those, and then it transcribes those, and then summarizes them, and it speeds up the note-taking process. So that's the getting the data into the system. Now that's even more data that you have to be accountable for when the patient walks in with shortness of breath and chest pains into your ER. Now you have to know about the information that's not just in their health record, in what we call in the geek world structured data, but also buried in this text of these notes. What do you see coming along there?
It's one of those areas that right now hasn't, it's far more difficult that it's just that those things can be important because, I know that if you're a person sitting down with their cardiologist, they have heart failure, their conversation is going to be, there's going to be a discussion about what, what they, they've had discussions about, if their heart fails further, and if I have an idea of what that conversation they came, if it could be boiled down, then it gives me an idea of where I'm headed, if I'm headed in to have a similar discussion, or if a person whose family member is doing poorly, those conversations of what they've talked about prior is helpful and they're usually buried within that part that is not summarized, not structured. And that can be a challenge, because little things of, say, the person was at one point put on a life support and it was difficult to get off the vent. I'm much more less likely to just jump to putting them on the vent if they've had problems getting off, because goodness knows you wouldn't want to put your elderly 90-year-old family member on a life support machine if they just 6 months ago had difficulty getting off of it and they were miserable. You'd want more of a conversation. See, maybe we can slow this, give it a little more time. Yes, it's taking a little risk and they may die from it, but at least the patient's going to be, we're getting what they want, what is their values, and it's certainly not. And so those things can be buried in the non-structured data, those conversations.
I think we all have a story kind of like that, where, there's something in our record that got past the doctor or the pharmacist.
I can talk about that. We talked about this earlier. I apologize at the beginning because of the sinus infection and cough I've had. It was bad enough that probably about 4 weeks ago I went to see my GP, and he put me on
antibiotics. That's not a prop. That's not a prop for this talk, is it? You didn't acquire that cough.
No, it's naturally occurring. But I saw my GP, who I've been seeing for a very, very long time, and he's got literally 25 years of records on me. So there's some things I told him. I'm on some biologic drugs for arthritis that I probably told him 7 or 8 years ago. I don't think I filled out a sheet on what drug are you taking recently. Anyway, he puts me on antibiotics and steroids. So my rheumatologist calls me up later and says, "What's this about you having an infection? How come we didn't know about that?" I say, "Well, it's occurred since I see her every 3 months. It's occurred since then." And what she said was this biologic drug I'm on for my arthritis makes that antibiotic drug completely useless, completely ineffective. So because my doctor didn't remember from 8 years ago that I told him I'm on these drugs, or
Yeah.
because I was one of 30 people he was seeing that day, I didn't have time to look up through a stack of papers this thick. He just prescribed it. And because I didn't go back to my rheumatologist to tell her about it, she didn't have any input on it. So I essentially had the bad side effects of antibiotics for 10 days with none of the positive results. And now weeks later, I still have this cough and a sinus infection. So that's an example of if my doctor had even some simple way of cross-referencing drugs to say, I'm going to prescribe this antibiotic. Wait. It looks like you're already on this
Yep.
other drug. I can't do that until you've had enough time to get off that drug. That's an example of where good information would have been a better outcome for me.
And in your case, it caused a week or two of discomfort, maybe extreme discomfort, but discomfort,
annoying discomfort.
Yeah. Not permanent impact and not death. And yet we see that, Dr. Hightower, we see that, and there's that risk on your shoulders, isn't there?
Oh, there is. I mean, in this case here, he was fortunate. He's just had those side effects. I mean, it could have been where that drug he was put on basically killed all the good bacteria in his colon, and he develops what's called Clostridium difficile, which is basically the bad bacteria takes over, and he gets belly pain and chronic and severe diarrhea, and it can be something that's very difficult to get over. And so he could have had that side effect. And so when you're putting someone on a med or antibiotic, those are things that we consider, and we consider it more so because goodness knows you don't want to make a person worse. So,
well, let's talk about solutions, because while there are all these challenges, we're not just here to complain about them. We're here to do something about them. And all of us, all three of us, I know, are passionate about this. So if you could pick a couple of your favorites off this list and talk about how technology, and specifically the automation of making data available for the doctor or nurse or provider, whatever the case would be, how
the patient.
technology is making a difference for you today, and where the gaps are.
So we'll just go through them. On the time saving, certainly when there's critical moments, I have a limited amount of time, and there's some very things that I need right away if it's in those critical, if the patient's certainly if it's a definite critical situation and a life threat, and if the healthcare data is a person to the system, then that data is at least more accessible. If they're in a different system, different state, if they're that all those things add challenges, because it's a layer that I have to go through that I may or may not have access to their previous medical record. Enhancing the patient experience, anything that can give me help on data that applies to this person, if you could do it specifically, this person's potential chief complaint, that would be something that would be helpful, because that's going to then give me more time to be listening to my patient, not just looking through the medical record, because I'd say we spend more time looking through the record than the face-to-face stuff. So there's that. Then there's the other issue in regarding to enhance, and so that's on the face-to-face, the experience. There is legal implications, because I practice under that. You miss it, and if it's critical information, you can be certainly held liable for missing that information. That would be, someone would say, oh, well, didn't the information is there, but you didn't check. And then it would certainly lower the risk. Those things would lower the risk and potentially help me on making an informed decision and lower my overall stress, and keep me in the field, or my partners in the field. So all those things could be helpful by being able to manage the data, and the data that's specific for my area of expertise and specific for that patient themselves, for that presenting chief complaint.
So we've talked about technologies for recording your conversation and then summarizing it for you to add to your doctor's notes. That's automation in a way. We've talked about combing through that record to present to the profession, to the healthcare professional, to the provider, what is relevant within that record given the current conditions. We had a webinar with Bill Inman last week where we talked about the ability to comb through the doctor's notes in the health record, that unstructured data, and then provide a pane of glass view to the healthcare provider. So those are some examples. And we at InfoVia, using WhereScape, are passionate about automating that process because we can't expect our healthcare providers to also be technology experts. So we take that upon ourselves, and we take it seriously about speeding up the process of collecting the data from all those 3 types of sources, but thousands of sources that are out there for data that could help you make better decisions. Then we take the step of integrating that data so that you can compare a diagnosis for your patient in front of you to the diagnoses and treatment options as it was applied in the population that had the large record, whatever size that might be, but as much of the population as we can have access to, we can start to apply these analytics, advanced analytics, even AI, but not necessarily only AI, to those large sets of data, and in mere seconds, make a recommendation to the doctor. These are the things you should know about. These are the options that you should consider. These are the things you should be aware of as a risk. Is that helpful?
Yeah, I mean, the same things like that would be helpful if it was presented in such a way that would enhance, so that the person didn't get what we call anchored or siloed, or so you keep these other options or things that you have to consider in mind. Yeah, so those things would be helpful.
Sure. You talked a bit ago about the default treatment versus if you knew more about the patient, you might avoid that default.
Correct.
In Patrick's case, it was the default drug assigned, and you mentioned the heart attack victim that you wouldn't put them on a ventilator again because they had already been on one in a previous incident and had a hard time coming off. That could be a fatal decision right there.
Well,
in the
the other
ER, could it not?
I don't know if I say on it. Well, it makes a difference on, I'd say look at it from a little different perspective is on a quality of life issue. Okay. If you're going to tell your 90-year-old family member that the chances of them getting off is poor, and maybe then it's a time for us to have to spend that quality time with family than, being on a vent and missing that quality time. And so, that at least brings up, I have a chance to have a conversation with that person. What do you consider quality? You want the chance of being put on, or we put you on the vent with a low chance of coming off and a low chance of any time with your family, quality time, or we try to address some of the symptoms, but we also, so that you can use the time that you have with quality time with your family members. I myself would be choosing the quality time. If there's virtually no chance or very little chance of me coming off that vent, and there's very little chance of me having quality life time, as well as little that then, while we're trying to do all this stuff, you miss the window and you miss out on the quality of time with your family. And so those things, I think it's more of a quality of life issue for the patient, and it's quality of life for the family members too. I think all of us would choose, we'd rather spend quality time with your family member, even if it's a short amount of it, than no quality time, and you spend longer time at the bedside in front of a vent with no communication, et cetera. I think most of us would decide on the quality side.
Well, I would, I know, and I had an experience recently where a loved one wanted to take the mask off, even if it meant pain, maybe even less longevity, because they had some things to say at the end of
Yeah.
their life. And I think that's quite common. So helping them make those decisions, that quality of life in our industry, in the data world, we talk about quality of data, which can mean the completeness of the data. Do we have the whole health record? Are we comparing it to the whole population? Do we know all the risks? Do we know all the drugs that the person might be taking or prescribed at the moment?
Right. But
Then
even
the
in
accurate.
that non-structured data, even if I had the prompt and had you all searched within the patient's medical record on quality of life or quality of life discussion, and it searched through the non-structured data, and it would pull out that one statement there that can make a huge difference on on the discussions with my patients. Just that one,
Sure.
that was one findings, because that would go through every one of their docs non-structured data and pull it out as to what were the conversations. Their cardiologist, their primary care, their internist, their rheumatologist, it'd bring it all up. And I think that would be valuable.
We're close
You
to
know,
that. I was talking with someone who's using AI for published medical papers, not records, papers, and they'd trained an AI engine to read through these free-form papers, research papers, tens of thousands of them, and identify: here's the patient, here's their gender, here's their age, here's their symptoms, here's how it was treated, here's the results they got, all sorts of information which you can take from that free-form text document and rearrange it into what might be called structured data. So you talked about, you didn't say pigeonholing, but that's what I would call it. Siloing, I think is what you called it. Getting a predetermining of a patient's condition before you know all the facts, and limiting your treatment to a certain thing. This allows you, like you said, to comb through. AI is at the point right now where you can comb through tons and tons and tons of records and get that critical information rising to the top.
Well, quality of data is not only that the completeness of the record, but like you said, it's the summarization, the accurate summarization of what's relevant. And then it's the timeliness, presenting it in a timely fashion, especially when someone's having chest pain in front of you in the waiting room of an ER. So, in all those cases, automation, we've seen that work in other industries. And the healthcare industry, I think my challenge to the healthcare industry is we're solving this problem. InfoVia has solved this problem of timely, accurate, secure data. We haven't even talked about security, but I think it almost goes without saying. We need to protect these health records as well. So it needs to be accurate. It needs to be timely. It needs to be complete. It needs to be secure. And technology can do this. In manufacturing, we're finding defects earlier in the process so they don't continue throwing money after bad parts, or so that they can correct them earlier in the process where it's less expensive. In education, we're finding early indicators of a student's disengagement. So you don't have to wait until they fail the test to engage with them. You find that out of from other behaviors, specifically how they're interacting with their students and staff online. That's an early indicator of a disengaged student if they stop interacting. So we're doing this in other industries. Let's do it in healthcare. Let's partner together. The lives are on the line. The health of my family and my loved ones here in Idaho and beyond is on the line for this. I'm passionate. I'm excited, and I know automation can help with this because we're doing it in other places. Thoughts?
I'm passionate from a standpoint is if it can improve the quality of care, and also if I can address some of the quality of life issues for patients, and if I can do that, because goodness knows it's the quality of life that I want to improve, and particularly in the elderly. And I think that AI and also looking into the figuring out ways to summarize and look at the data so it can be presenting it in such a way that can be positive to improve the care. If we can do that, that's what I think would be a success. It would be a gain from a quality standpoint for my patient, would be a gain on connecting with my patients and spending quality time, having some discussions that are really important to them. So I look at it that, yeah, that this could be something that could make a huge difference.
In our practice, I'll call it a practice, InfoVia provides professional services for organizations attempting to gain better insights for their data, return a higher return on investment for the data that they've spent the time to collect. It costs a fixed amount to collect that data. The more you use it, the more value you get out of it, the lower that ratio of usage to cost. And so we try to use automation in every way that we can, whether it's collecting the data, like in the case with your doctor's notes and the summaries, whether it's presenting the data, like in the case of a single pane of glass, whether it's securing the data, putting a moat around a person's health record so that it doesn't get out into the wild. Once a health record for a person is released, it's pretty much the most sensitive data out there because it can't be undone. If my bank account is breached, I can get a new bank account, but I can't ever get a new health record. Once it's out there, it can do serious damage to people's livelihood. Maybe they lose a job. Maybe they're shunned by their neighbors because their health record was released. So we as data professionals, as well as you as health professionals, have to contain that. And we use automation in that as well. So with our clients, they get a packaged data product that they can use to make better decisions that is faster, more complete, more accurate, easily to use, and secure, safe to use. And my challenge to those of you who might be out there in the health industry would be to engage with us and see how what we've done for manufacturing and education and finance and insurance can work in healthcare as well. Let's bring it up to the 21st century that we're a quarter of the way through already.
I'll just jump in and say we've got about 15 minutes left. So I'll remind everybody that there is a Q&A button at the bottom of the screen. If you do have any questions, feel free to type those in. Yeah, you
Sure.
talk
While
about,
we're waiting on
you talk about data
questions.
quality, about timeliness and completeness and accuracy. And something I'm going to add to my list now is correct summarization. I think that that's a very good point of data quality as well. Is that that's when we talk about AI, and AI shows up in this presentation and a lot of presentations. A huge phrase you hear again and again and again is the quality of data. Garbage in, garbage out is one. Mike introduced me to a phrase earlier this week. What was it? Man in the loop or person in the loop?
Human in the loop. Yep.
Human in the loop. The idea that you're getting information from, system A and system B and system C, and it has to be brought in timely, has to be collated, correlated, and corrected. And the Mike and InfoVia can certainly help build that tool, build that system. That's what they do, and they do very, very well. At WhereScape, what we do is we provide that automation. And automation is a way of repeatedly doing something correctly, getting the person out of the loop, getting fewer hands on keyboards. So the idea is that you can generate that information system, again, data warehouse, data lake, whatever it is, faster with better quality, better timeliness, and get results to the end users. In this case, the doctors and practitioners much faster.
A plug I always like to put in for your approach there at WhereScape that I love about your product is, as an IT person, I'm worried about the longevity of the solution I'm building. And your solution builds its own documentation. So the documentation inherently matches the data pipeline and the mappings and lineage and transformations that are going on there can be transparent to the people using that data. And that's really valuable. Making that black box transparent, to me, is a key feature of WhereScape, and it's why we continue to use it in our data practice.
I was surprised when I started working at WhereScape of how documentation, both how was the data warehouse created, and what does the user interface look like? What does this data mean? Where did it come from? All those kinds of things. I was very surprised to find out that that's actually a big selling point. I always describe documentation in a development process as that point where someone runs around, grabs all the Post-it notes and types it into Word. It's something that everybody wants, but nobody wants to do. That's nice that we can, because of the way WhereScape works, we can generate automatically and have up-to-date documentation every morning.
Well, in the interest of completeness, accuracy, and timeliness, if you're generating it, it costs it doesn't cost you human capital to generate that documentation, and it matches. So, well, like I mentioned, I was a WhereScape customer before we built a practice around it, and this sold me. It was that documentation. I knew I could write code to do what WhereScape does, but could the next person maintain that code? Could a team work together to manage it over time? And what we've proven in literally dozens of successful applications is that it can be done. There is a better way of managing data, and it's using automation, and it's using metadata, and you're generating your documentation, generating your pipelines. I'm a little bit passionate about this, as you might be able to tell, almost as passionate as David is about saving lives. I had a little comment coming in about the interoperability and standardization of principles within the medical industry. Of course, yeah, we have to bind together. There needs to be, for me to share data with you, we have to have standard language, so to speak. So that interoperability is paramount. Health data exchanges are trying to build that fabric of my record is contained in various systems out there. Let's make sure that they're talking to one another so that we can get our hands on that complete patient record instead of fragments of it.
I think what's cool over the next few years is, as you said, not just that integration of data, but the integration of unstructured data, be it MRI scans or notes someone has written, or whatever it is, that freeform text and fields like that. I think that's going to be a huge outcome of a successful outcome of the AI. I don't know what we call it, a revolution. Changes that AI could potentially be bringing to the forefront, and that only helps in having that correct information that's critical and timely in front of the right people at the right time.
Yep. Well, Dr. Hightower, I want to give you the mic again and just challenge us as technologists. You've mentioned a few ways, but in some parting comments here, if you just think through, what should we as technologists be doing to help you do your job better? What's a good parting line, if you will, about how maybe we can leverage automation, data, maybe even AI? What's something that we can be doing for you and focusing on so that you can save lives and make people more comfortable?
I think it's, you've touched upon a number of them. I think AI is certainly, we're heading into this AI age. If we can, I guess for myself is put each one of you, put yourself in the position of the patient or your family members, and how can you leverage what you all are doing to improve my ability to access the relevant information in such a way so that I can provide the best quality of care to you and your family member. And yeah, that's if you can, and in such a way that it enhances the patient physician experience. So, however, with that in forefront, there, those of you that are creative in this area, that's what I would want to encourage you. How do we enhance that quality of care, that physician-patient relationship, not further complicated with the wrong amount or too much, or et cetera, or just the frustrations of learning another system. So I'll have that. I guess that's what I would say, because that leaves it more in the side of the creativity of what's going on as you all as we move forward. These next few years, keeping those things at forefront is what I would encourage.
Thank you. Could I be so bold as to change the A in AI from artificial to automated intelligence? Let's not settle for artificial. Let's automate it and integrate it into our business processes and into our thought processes and put the right data in front of the right people at the right time to make the right decisions.
Yeah.
Well, Patrick, do you want to wrap us up today?
Sure, it's a couple minutes early. It is 22 minutes after the hour. So, Dr. Hightower, I really appreciate you joining us. Mike has met you before and talked to you before. We met briefly on Monday and talked. I'm very impressed with your insight, your openness, your philanthropy, and compassion. I mean, it's every time you talked about something, it was about patient care and patient quality, which I really, really appreciate. I know it's easy to get absorbed into the minutia of an occupation sometimes, forget that you're actually dealing with real people. But for you, that seems to be front and center all the time.
Yeah.
Mike, thank you for arranging this. Thank you for getting InfoVia and arranging this with Dr. Hightower. Again, this is recorded. If you have questions that you think of later, feel free to contact us. We've got contact information for contact at infovia.com. You can also do contact at wherescape.com, infovia.com, or wherescape.com. Mike, thank you for like I said, arranging this. Do you have any final words for us?
Hey, we're here for the health of it. I know I've stolen that, but there will be a day that each of us needs technology to help with our health and certainly our loved ones as well. And so I'm in and passionate and willing to participate with anyone in this industry that wants to make things better.
Yeah. And I agree the same. I'm also, I think all of us would say, we want to be significant, not just successful, but significant. And if we can do that as far as with patients and healthcare, and that's huge. That's huge.
All right. Again, thank you all for attending. I appreciate that. And enjoy the rest of your day. And again, thank you very much, Dr. Hightower, and thank you, Mike. And we will have this recording available for you.
Thank you.
Thank you.
Bye-bye.